Hi, good evening. Welcome to another episode of Let's Talk About Mental Health. I'm Nels Kloster, an addiction psychiatrist working in Southern Vermont.
And my name is Robert Stack. I'm a licensed alcohol and drug counselor and licensed mental health counselor. Good evening.
And just as a reminder, for questions, you can message us at our Facebook site, facebook.com/letstalkvt, and that is case sensitive. We look forward to your questions.
And you know, last week we talked before the show. We talked what we're going to be doing, and one of the things that was up was Philip Seymour Hoffman. Is that his name?
Right.
Hoffman. And he had died from an overdose. And I must admit that I didn't really react that much to it. I mean, I sort of thought, well, here's another heroin addict that had died. And, you know, I mean, there's
another famous.
Janis Joplin, Jimi Hendrix, and Kurt Cobain, and
Heath Ledger.
So you know, and I have to admit that, you know, over the years I've sort of, you know, I've been knew heroin addicts when I grew up, and that's what the heroin addicts do, is they die.
Yeah.
And not all of them, but many of them do. But I've noticed that since his death, it's been in the news a lot. A lot of people looking at it, talking about it. And it's kind of interesting, not interesting, it's kind of interesting in a sad way. But Governor Shulman stated a state address a couple of weeks ago talking about the heroin epidemic. Then there was the national news talking about the death of this young, talented actor. And then locally, we just recently, there was reports of 3 young Vermonters.
There were 3 deaths in Addison County from fentanyl in the heroin. Working in Bennington County, as well as here in Windham County, I you know, with regularity get reports of deaths of addicts that were known by patients that I'm working with. Yeah.
And a few years ago, people were talking about deaths from methadone in Maine and stuff, but it wasn't. But I guess I just want to maybe repeat myself, but you know, I think on some level that's maybe one of the problems with our heroin addiction in Vermont, is that not enough has been said about the downside. I mean, you know, I mean, it's sort of, I don't want to say, but I think in some level, some of our young people were naive about what drug use was about. And some of that might be from previous drug experiences where everybody said they were bad, and they said, you know, I got away with it, nothing bad happened. But I've always considered IV opiate use like sort of crossing the Rubicon. I mean, it's really, it's very hard to come back from it. It's very hard to stop. People struggle with it their whole life. And quite frankly, I mean, we put a lot of emphasis on needles, HIV, you know, from injections, and we made, you know, needles more available. We put them out there saying, okay, this will be helpful. But I think maybe we forgot to tell people, well, you know, the drug you're putting in your body is going to kill you.
Yeah.
And I almost feel that in some ways that, you know, there's a, you know, people think, well, I take a pill, I'll take an Oxy, I'll take a Percocet, you know, and these opiates are sort of innocent. We can split them with our friends, we can take a Suboxone strip, we can cut it up. And I don't think people realize just how dangerous opiate addiction is.
Yeah, public attitudes are really kind of lax around a lot of things. You know, with the death of Philip Seymour Hoffman, and like we said, we both thought, okay, another famous, you know, actor who died, and we just get kind of numb to that. But then the reason why we talked about actually mentioning, you know, his death amongst, you know, our local deaths as well, was that as more came out about this, this is a guy who, I guess he was 55, and at 22 he gave up alcohol and drugs. And he had been sober for 23 years, and from all indications had been a real source of inspiration and support for a lot of other actors, and in general in the you know, the 12-step, the NA or AA community around this. And so a lot of people were scared to say, you know, oh my God, is it really, how fragile is this recovery? If a guy like him, you know, that's the idea, if a guy like him was doing everything he should, was as talented as he was, and this kind of thing happens to him, it really puts the fear of God, if not discouragement, into a lot of people who are trying to stay clean.
Right, and I mentioned that last week. I was talking about the woman actress who said she was going back to Indiana or something, and after many years of being sober, she was going to drink with the ladies. She said, you know, this is what I'm going to do. And I wish her well with that. But the truth is, you know, for a lot of people, the illness of addiction or alcoholism, it never really goes away. I mean, you always have it. And there used to be a suspicion or thought that the illness itself will actually get worse over time, even though you're not using. And then that's hard to believe. You go, well wait a minute, that doesn't make sense. But what I've seen over the years and what you hear anecdotally in the field of addiction is that somebody will pick up after a period of not using, and not only very quickly, in a very short period of time, they're back to using what they used to use,
right,
but they're using even more.
Yeah, it's as if the brain has this sort of dormant memory of what it used to be able to do. You know, cigarette. If, you know, there are enough people who are watching who have smoked cigarettes or experienced someone who smoked, you can quit for years, and then if you pick it back up, people tell you it takes no time at all to be back to that pack a day or 2 pack a day habit. So same thing with opiates, same thing with alcohol, right? And it just progresses and gets worse and worse as you get older. And I think that maybe sometimes, you know, sort of abuse or use of something gets confused with the actual sort of dependency or addiction.
Right.
You know, there's a well-known study by a guy named Mark Shuckett, maybe back in the 80s it might have been, and he looked at alcohol in particular. And what he determined was that abuse of alcohol, and typically like around, you know, you think about college and frats as sort of that age group right there in the, you know, late teens, early 20s. And he noted that abuse of alcohol was not always or necessarily a stepping stone to dependency or addiction. That many people would then sort of correct themselves. They got out of that environment. They started moving forward on career and families. And their drinking decreased, they stopped abusing, they did not go on to become alcoholics. But if you go past that stage, though, it's a very dangerous sort of thing. You're starting to kind of slide into a whole different realm. And I think people sort of miss the notion that starting something really can put you at risk for continuing to slide if you're at risk because of, say, genetics or environmental factors.
Right. And I think a lot of people always say, and again, I think it's naive. They'll say, well, I'll stop when it becomes a problem. Well, the issue is that it isn't a problem for you. I mean, and then you continue to use, and by the time you're ready to stop using it, you find out that you can't. I mean, because by that time you've developed dependency. I mean, it's sort of like, and I remember trying to understand this when I was learning about addiction in the brain, and they used to talk about pathways, that there were pathways in the brain, in you know, different systems. And the way I come to understand it was almost like if you ever see a logging road in the woods, you know, skidders or like an old trail. It grows over and everything, and you know, but yet it's still there. It's in the woods for a long time. You can see it, and it only takes one skidder to come through again to open it up again. I mean, and that's really how I think about it. I think for alcoholics and addicts, there's a pathway of addiction. People say it's an Olympic system. I'm not sure about that. But the idea being that it goes dormant, but it really never goes away. And I think it's so tempting. I understand with Mr. Hoffman that he after all that period of sobriety, took a pill for pain medication. And that's always a risk factor for addicts and recovering folks. I mean, they just feel like they can control it, feel like they can go home, and you know, it's really difficult.
Yeah. No, I'm always telling my patients because of this, you're doing well now, and even if you eventually come off of this medication, whether it's the Suboxone or the methadone, I want to plant this seed for you right now that when you're 60, 70 years old and you're getting ready to have a knee replacement or you're getting ready to have a hip replacement, I want you to tell that surgeon that you were an active opiate addict back in your 20s. Yeah. Because that is going to kind of lie there, kind of waiting to kind of, it's a kindling that's going to wait to sort of burn and take off on you. Don't ever, ever, ever forget this.
That's right. And I don't want people to suffer unnecessarily. I'm not one of these like people, oh, you can never take pain medication. Well, if you need it, take it. Yeah. But be careful. Give it to someone else to hold it. Be really strict with the medicine and take it as it's prescribed. Yeah. I mean, even your attempts to limit your intake, what you might end up doing is taking more of it to catch up with the pain.
Yeah.
I mean, in other words, like, well, I won't take one this morning and I'll wait. And then by the time you're taking, you take 3 in the afternoon instead of taking 1 every 4 hours the way you're supposed to take it. So,
and again, the addiction doesn't mean that you should be in excruciating pain. But if you tell the surgeon, for example, that you've had this problem, then rather than like so many people we know get these surgeries when there's no problem suspected, they get a huge supply of this medication, and then it's just again it's a temptation, it's a danger. Whereas if you say, look, you only get it a day at a time, every couple of days at a time, it's given to your partner, or in some way it's controlled. There are ways to get through this without putting yourself at greater risk and still not going through so much suffering after a procedure that would warrant this kind of treatment.
And that makes me think about some other articles that were currently in the news and stuff. And one of them that was the number of deaths and number of children that were born with opiates, with some kind of withdrawal symptom, and how that has grown or increased, if you will, in New England. And the risk with that.
Right. I mean, the Reformer had a couple of articles today, right? One was by an editorial by the or column by the Brattleboro Prevention Coalition, and that talked about the Youth Risk Behavioral Survey, which is done in Vermont every couple of years. And then there was another one about generally about I think it was on the front page, and about New England addiction problems. And evidently, 7% of babies born in Maine, was in 2012, were affected by their mother's drug use, which means, being born with withdrawal. I think maybe 1% or so in New Hampshire, and they didn't really mention the numbers in Vermont. But I know, talking to Fletcher Allen in general, they've been keeping track of this, that it's a growing issue. And whatever the numbers are, everybody's saying that it is doubled or tripled in the last 10 years.
That's right.
So becoming a really big deal.
And people are sort of looking at it, and I think Governor Shumlin covered both of these aspects, but it was really clear in the article that was talking about treatment. It's an epidemic, it's an illness, but and we need to increase our treatment availability. And yet the governor from Maine was saying, well, I want to go after the sellers.
Yeah.
I want to go after the dealers. I want to increase the police. I want to increase the courts. I want to really crack down on that.
Yeah.
And you can criticize that, but I'm not ready to do that. I think it's a little bit of both.
Yeah.
I mean, if you're in a community looking to make money by your peddling, heroin, you're going to make a lot of money. But I'm telling you, if you get caught, you should get punished. Yeah. And this foolishness, I heard one politician say, well, all the people there are selling dope to support their habit. Well, you might see that at street level, maybe. But most of the people who are selling dope to make money. Yeah. I mean, you're not a big-time dope dealer if you're shooting dope. I mean, it just doesn't work that way. Yeah.
By that time, you really are more of using yourself. You're incurring a little bit of risk by driving down to Springfield, Holyoke, and bringing it back. But you're probably sort of using that profit then to be able to pay for your own prescription too. So it's a little bit of each.
Yeah, but and you're turning on other users, and you're recruiting new users and selling them because they pay more and all this. So I think on one hand, I do want to treat it as an illness, but I also want to recognize that it's an illegal behavior, and people need to be held accountable for it. I mean, so I don't know. It's
well, bars are held accountable if drinkers, patrons go out and have get a DUI.
Right.
Then they always want to trace it back to that establishment. And then I know the Alcohol Control Board in the state then focuses on the establishments that are not doing such a great job of, curtailing, drunk driving.
Right. And they are. And I know just recently I heard someone talking about somebody's doing 16 years in jail because they sold heroin to somebody that died, and that seems unfair. And it was just, and I'm as liberal as the next person. I thought, I don't want to put somebody away. But on the other hand, I mean, I just think I think we have to increase this idea that heroin and opiates are bad news. And I'm sorry that they came through the drug companies and the salesmen and all the pills, and people got into it. But people need to understand this is an evil, high-risk, deadly drug.
Yeah. I think it's the question, how do we get that idea across? Because when you look at the money spent, at the return on your investment, clearly there's a better return on investment by money spent in treatment. Money spent on stopping the transport, interdiction, you seldom even make back your dollar on those efforts. Whereas if you look at specifically methadone treatment, there's a $4 payback for every dollar spent. Decreased health costs, decreasing illegal incarceration costs, right. Increased productivity, and in treatment in general, $7 for every dollar spent payback. So again, it's a very complicated issue. There's this desire, right, to punish these evil people who are bringing this garbage into our state, but there's a practical aspect that people need treatment. So I'm glad to hear the government sort of talking about putting money into that.
And again, the whole, opiates came in on pills, right? Oxys, most people agree with prescription pills. It was really the birth of the epidemic or the start of the epidemic in Vermont. And they've done a good job of sort of, getting after that.
Right. National trends show a leveling or a decrease in the amount of opioid prescriptions the doctors are writing.
But at the same time, we have countries like Afghanistan and Colombia and South America. We have Mexico producing heroin. And it's sort of, just to figure this out, if you have opiate addicts, you have people using opiates, and if you cut down the stream on the pills, and yet there's an increase in supply of heroin,
no-brainer, right?
Yeah,
that's where they're going.
And so I think that's what we're looking at. So when people talk about like a heroin epidemic, it's not really a heroin epidemic, it's an opiate epidemic. And then people have gone from one form, prescription pills, have gone into a more older, traditional, shooting heroin.
Yeah, but as far as your brain knows, it's the same thing. Whether it's heroin or it's morphine or it's oxycodone, it's Percocet, Dilaudid, methadone, Suboxone, opiates are opiates, and they're going to light up the brain in the same way.
And again, the other survey that you mentioned, the one at risk, because I just want to say that, I was reading somewhere where it says it looks like cigarette smoking is really going down.
Yeah.
And really, and the number of people, of new users, is decreasing.
Right.
And that's really clear, that the message is out there. Cigarettes are not good, and they're negative. And I said this last week or 2 weeks ago, I had clients who were doing opiates that didn't smoke cigarettes. It's sort of,
there's a craziness too, right? Say maybe, 10% of kids will smoke, which is down from maybe about a quarter decades ago. Mm-hmm. Fully like 70 or 80% of kids, and this is in that youth risk behavioral survey, who think it's a bad idea to smoke cigarettes. And then maybe like say 97% of kids per this survey have not used heroin. Great numbers like 90%, 80-90% had not ever used prescription medications inappropriately. But then you look at some of the attitudes about what they think is good or bad. While they think smoking is bad, less than half think that drinking 5+ drinks 1 to 2 times per week is harmful. Less than a quarter think that smoking marijuana is harmful. And of course, again, maybe we've got the biases we've acknowledged, but that just sort of seems crazy.
Right.
That with drinking and smoking pot, driving impaired, decreased inhibition, of course, teen pregnancies or physical injuries can occur. Whereas smoking, great, it obviously is bad for a number of health conditions. The danger is about 30 years out. It's highly addictive. But these all, this strikes us as a package of risks that really should be intolerable, but it's not even perceived that way by our kids these days.
Right, and you see it, it's sort of this idea, and I don't mean to attack anybody, but the people who have been really struggling to make marijuana legal, and I mean legal.
Yeah, because that's their agenda, obviously.
Yeah,
They've said it on TV.
In the beginning it was, we just want to use it for medical purposes, and they lined up, 20 very sick people and said, here's what we want to put, And behind that is like, 10,000 stoners. It's sort of, and they're, they've gone to great lengths to say, not only is it beneficial, not only does it help people, but it's almost benign. It's and like we talked about last week, it's no worse than alcohol, which is another killer. And I think people have sort of, I think if you're a young person growing up, and if someone asks you, do you think marijuana is a bad thing? I think your impression is no. I mean, my adults or my older people, it's, people talking about legalizing and blah, blah, blah. And I think that's, I think that's unfortunate. I hate this idea that they mentioned there were so many kids, not that many, but there were some that were driving impaired. They admitted to driving impaired.
Yeah, within the last 30 days, about 150.
And that's kind of, I don't know. I mean,
it scares me. I drive to work.
Yeah, I mean, I don't know what to make of it. You know what I mean? Like, what do these numbers mean? And I think the good news, and the woman in the article, the substance abuse person who wrote the article, she admitted that there was good news there. We have kids that aren't using, and I always think that, sometimes we don't give enough credit to the kids who aren't using, and I've said this before. And we have kids who have made decisions, teenagers, and all of them have choices. I mean, you can find drugs in any neighborhood. I don't care what neighborhood it is. And you can find drugs available. And I think most teenagers make decisions about what drugs they'll use and what drugs they won't use.
Yeah, because most of these kids said, maybe it was 70 or 80% reported to be AB students. The majority of them were involved in some sort of community service. The majority of them reported that they talk with their parents at least once a week about school, that they also had an adult other than the parents who was a good example and involved in their lives. And these are acknowledged as sort of resiliency or protective factors, these sorts of things.
Right. And one of the things that we know that meth never really took off in Vermont, though I saw somebody who was arrested for dealing just recently in that. And one of the things that they think was that by the time meth got from here, from California, from the Midwest and everything, there were these pictures of people who used meth, and they had no teeth. They really looked terrible.
The skin was terrible.
Right, they had here they were 3 years ago, and here they are today.
Yeah.
And a lot of people credit that with sort of stopping people from saying, "Oh, I'll do some meth," and they're like, "No, I don't think I want to do that drug."
Yeah.
So I think there is. If you give people information, if you give them facts, and I don't mean scare tactics, I mean facts. You say, look, this is what happens. This is the risk. It's like, we were worried about IV drug users, transmitting HIV, so we made needles available. We said, you can get needle exchange or you can get a prescription. And I think that's a good idea. I don't want to see the spread of HIV or hepatitis C, but I think we sort of, maybe, I don't know, maybe we missed the message in saying like, well, wait a minute, what you're putting in your veins is not a good idea.
Yeah.
And the people who do it end up in jail, they end up sick, they end up lots of things. And then and some of them die from it.
Yeah.
So I think on some level we sort of missed that a little bit.
Yeah, and a lot of people say, well, look, I've been smoking pot since, the 60s, and look at me, I've got a job and all this and that, but I think that something is missing is that as we become more permissive in general about this sort of use, then the beginning of using is going to trickle down to younger and younger people. And then we know from alcohol statistics that if you start drinking before you're 14, you have a greater than 50% chance of becoming an alcoholic, whereas if you wait until you're 21 years old, then the risk decreases to about 10%. And what one of these surveys showed, which really shocked me, is that for those reporting first use of substances, whether it's prescriptions or marijuana, alcohol, or cigarettes, just under 13 years old was the report of first use. And then for, alcohol and pot came later and cigarettes sort of came last. So in a way, you have people who are starting in this critical age before 14, where we know if you're drinking before then, you've got a very, very high likelihood of problems ahead. And that sort of gets missed in all this. We're talking about permissiveness for adults and losing the impact on our youth. And that, I think, is going to build up and catch up with us over time if we don't do something about it.
And I like to believe that we are, and I hope they do. I mean, I hope they begin to make it really clear. And the other thing, and I know that you're actively involved with this in Bennington, and I want to talk a little bit about it because I've talked about how sometimes with women who find out they're pregnant can sometimes stop drinking, especially the first pregnancy, and they're able to sort of stop. but it's a little bit different for women with opiates. And I wonder if you could talk a little
Oh,
bit about that.
absolutely. But
I'm sorry.
yeah, no, and same thing too. I mean, I will still meet women who have stopped that sort of drug use for the first pregnancy, and then, like you've said before about sort of a disease, is that it gets progressively worse. And I think this is often the sign to women is that if they stop in their first pregnancy and they couldn't stop for the second one, that oh my God, what's happened to me? But I find too that I work with a number of pregnant women who are opiate dependent, and they're affected by the fact that, oh my God, I've been using opiates, it's been out of control, I've known that for a while, and then they're pregnant. And that is so frequently the thing that gets them into treatment for the first time. And I think that's a much stronger motivator than this idea we've been hearing from the governor about when the blue lights are flashing in the back window. That doesn't work nearly as well as something very positive like this. Rather than trying to stay out of trouble because of the blue lights and going to jail, this is about a better life. This is about raising my child well. This is about giving my child, benefits. And we know that, treatment works, and this is the safest thing to do for a pregnant woman. And if you look at most drugs except for alcohol, and maybe somewhat, cigarettes is an outlier as well, but opiate, cocaine use, that these babies might have some troubles when they're born with withdrawal. They might be born a little bit smaller than average, average birth weight, but that after a year you can't, they've caught up. And if you're looking at a bunch of 5-year-olds, kids entering school, you would not be able to point out who was the opiate baby, who was the cocaine baby, because they've caught up by then. And the real factors, again, if a lot of the scare comes from sort of, well, it's been, been racial, it's been all sorts of prejudices have been involved. If these children then have the chance to live in a supportive environment, their parents treat them well, they get jobs, they're fed, they're clothed and nourished, then they do okay. And I think that's part of the sort of prevention of this is by, at least what I feel like, working with these mothers, then we're trying to break this cycle so their children can be raised to be healthier. And that's really what prevention is about, trying to stop the illness from ever happening in the first place.
And I'll talk a little bit about it maybe in the future also, but I'm really hoping that with the single payer system, if that comes into being, I hope it does, that we'll actually begin to treat addiction, not only in the crisis, not only hospitalization, not only detox, but think about it as a lifelong illness, and think about how we want to help people, like in lots of different ways, and do it coordinated. You know what I mean? Like if all of us are paying for the treatment, if all of us are investing in recovery and treatment in these moments, it's like almost protecting our investment. It's almost like let's continue to support the women's, continue to support everybody in that system. And I'm really hoping that people will begin to think about that system in a different way, and not just think about when we arrest them or when they end up in the emergency room or when we treat them for detox, but think about it like in a different kind of system. What would it be? 85% of our young people are not using opiates, or 95%.
Because that's the worst level of prevention. Is once the illness is out of control, trying to stop people from dying from it and suffering from it.
So let's try and find that 5% that's maybe using in high school, or 10% that's experimenting with really. And let's not punish them. Let's not go after them like, we caught you, but more like, hey, listen, let us help you with this.
If you really want to do something substantial, you got to fight poverty and offer opportunities. And that's better than a sort of flash in the pan political sort of statements, even though I'm glad for anything that brings attention to addiction.
Well, this was our idea of this show, was let's talk about mental health and addiction. Because, and I'm so encouraged by everybody's, the TV, and I'm sorry that it had to happen because some people died. But I want to continue this dialogue. I hope that we continue to talk about this. And I want to thank everybody who's listening. And
Ready? 1, 2, 3.